Sophia? Now, most important question. Do you want to keep your teeth? Yeah? What was that?
Loud and slow.
And yes, I want them.
Yes, I want them.
Perfect. All right. So we'll pack them up so you can take them home, okay? Now, in your show bag, instructions for everything I've just talked about. There's a key for the turning and his molds. And we'll also send you a video to remind you how it all goes in as well. Okay? So I'll give you those.
So he uses them all the time?
Wearing all the time.
All the time.
So we want to eat with them, sleep with them, shower with them. They just stay in as much as possible and only out when you're cleaning them in the morning and cleaning them in the evening and turning them. Okay? So Sophia will go through and teach Leonard how to take them in and out, okay? All right, we'll keep the sunglasses on, swing your legs around, and Sophia's going to help you out there.
Okay, so welcome back, everyone. We have a special commentary here with Sophia, and who is the oral health therapist at Simon's practice for the last 6+ years. You there, Sophia?
Yes.
Okay, so perhaps you can give us a little bit of a background on what you're doing here with this gentleman.
So it's a new patient applying treatment, which means they have no experience and they don't know what to do with the plates. We need to instruct them to put them in and take them out the correct way so that they don't, so they develop good habits from the beginning and they use the appliances correctly to reduce any breakage and chances of failure.
Okay, so what are you basically saying to him? Imagine you're doing this all over again and he's in front of you. Can you perhaps kind of recall what you're saying?
So I'm teaching him, I'm making sure that he knows his left from his right, which is the most important step because the plates go in and out on specific sides. And I've shown him where they clip onto the teeth, looking into the mirror with the clasps, and so that he knows where to take them in and out properly. I've asked him to take them out from the left side first, lifting the lower one straight up from the tooth that it's clasped on and pulling it straight down from the upper tooth that it's clasped on. And that's how it comes out. Now I'm teaching him the sequence to remember to insert it correctly, which follows from the left side first. It follows from the left clip, left plastic, and right clip. I'm also making sure that the mother or the parent is on board and listening to the instructions as well, because they'll be the ones that are policing the child when they are inserting and removing the plate.
Perfect.
I very slowly several times so that they understand, and then I ask them to try it inside the mouth together very, very slowly.
So they're on average about 7 or 8 when they're first doing this, right? Like Leonard here is roughly 8 years of age.
Yeah, roughly that's the more ideal age for treatment to start. Obviously, we do have patients on either side of that. It just depends on the case and depends on what's going on.
Simon mentioned there's a video. So do you guys record something that they can watch a few times in case they forget how this all works?
Yeah, so after I instruct them in the mouth in the clinic, we send them an email with a video attached. The video has instructions in case they forget. We also provide written down instructions in that bag that you saw Simon hold and give to the mother at the beginning. And that has everything that we talked about as well, in case they forget.
you're teaching them how to put in the plates properly.
Yeah, I'm teaching him that it's important to push down on the plastic, but not onto the wires, so that we don't bend the wires and cause pain or moving of the plate to affect the fit. I'm instructing him to put it in from the correct side, which is the left side, and to check the fit with his thumbs and his fingers after he's put it in properly to make sure everything is seated down all the way and that it's fitting properly.
What seems to be the biggest challenge getting it right for these newbies?
Some of them do have a little bit more of a struggle comprehending instructions left and right and just hand and eye mouth coordination. So those ones do tend to spend a little bit longer. Most of them seem to get it within a few tries, but we have to caution against them being too comfortable and just throwing it in, biting at home, and damaging the appliances that way.
And now you're explaining the top one, or?
Yeah, so we start with the bottom one first because it's easier for them to see looking into the mirror. Once they grasp the lower one, it's easier to get the top one, which is harder to see, of course. So they have to feel their way around a little bit because you cannot see your own top of your mouth inside the mirror. It follows the same instructions, except the where you push and where the plastic sits is obviously different, and you have to line it up and feel your way around a little bit. So just instructing him nice and slowly how to get a feel of it and make sure that he understands the instructions clearly. Because it is harder to see, I do tend to guide them a little bit in the first couple of days so that they're not struggling by themselves without being able to see properly. I usually will show them by pushing on their knee or the side of their arm how much pressure that we can put onto the plastic parts to check the fit. That way they know. Some of them are too gentle and they don't push it down all the way. Some of them are too rough and they can break the appliances. So it always helps for them to have that sensory feel, what that should feel like, how much pressure is okay.
That's a good tip. And they have to wear this how often?
All the time. So the children only take it out to brush their teeth, which is twice a day. So no more than 5 minutes altogether.
So they sleep with it?
They sleep with it, they eat with it. It's to be worn full time.
Wow. Got to be disciplined.
Definitely. So the parents have to be on board, and that's very important.
Yeah. Yeah, I noticed, this child, I guess, is new and he's got a bit of a slouch. Is that common? I mean, kids, when they come in but they improve their posture over time through just in general, or maybe he was just slouching in this angle. I don't know whether it was the camera angle.
No, he was definitely slouching. I think it's a combination of poor posture, which obviously can be related to the malocclusion to begin with. Yeah. And also he to see the top of his mouth in the mirror, which is not really happening. So, got it. But with training and the GoPEX exercises, they generally do, or we ask them to improve their posture and help them to do that over the course of the treatment.
Terrific. Any other tips on helping the child getting used to wearing these appliances?
I think just take it slow with the instructions, be firm and clear, and set up the rules and the boundaries. They are not to take it out. Once they can follow that, they tend to get used to it much quicker than if they are taking it in and out and just being casual with the wearing time.
Okay. All right. Terrific. Well, thanks again, Sophia. We'll see you on another video. All right. Bye-bye.